Okay, hi class, this is Dr. Cilio. I am recording our exam to review. As you know, there won't be class on Monday, and we will can use that time to study for the exam, which opens Tuesday night and closes Wednesday at 1 p.m. So hopefully you've already gotten familiar with the study guide that I'm showing now. This is available on Blackboard. It shows you that the exam covers weeks 6 through 10, and these are those specific topics. And I also noted here, I have relied heavily on our lecture materials. So when it comes to studying, I really want you to focus on reviewing the slides and your notes from class along with, the study guide. I think the study guide is pretty comprehensive, so I would recommend going ahead and using this, building it out. I gave it to you as a Word document so that you could edit it. And, some things I've built out and been specific for you. Other things you're meant to, find and get familiar with yourself. It's just giving you direction. So I would recommend you do that. Otherwise, I have this brief lecture for us to go over some of those key concepts that are outlined in the study guide. This is not comprehensive. This is just a way for me to go into depth about a few of the topics within the guide, and then you can go ahead and review all of the other material. But hopefully this helps, bring some of that out in terms of my expectations. So I'm going to go ahead and get started. If you recall, the very first lecture that you'll be responsible for was actually quite a while back now, the Culture and Health lecture. So one key concept or definitions that you should know is the difference between disease and illness. So this slide demonstrates that just with the pure definitions and some examples. So the disease is the malfunctioning or maladaptation of the biologic or psychophysiological processes in an individual. So this is something that we can, doctors can sort of diagnose, that we have clear understanding of like what's happening in the body in order for us to diagnose it. So something like pneumonia, HIV, or polio. But illness is more about perception. So it is personal, interpersonal, and cultural reactions to disease or discomfort. So again, this is about perception, and this can really vary. As we talked about in this lecture, there are some illnesses that exist or perceived to exist only in certain cultures. And so that is really the main difference, that disease is broadly recognized from a biological standpoint, and illness is more about perception. We had some examples like cultures believing in body imbalance, like hot and cold, and that being a symptom or sign of illness, or emotional distress, supernatural causes like being bewitched or cursed, and that resulting in illness. So these are very culturally specific and align with the definition of illness. So I also have on your study guide expectation that you know what a conditional and unconditional cash transfer is. So in that Culture and Health lecture, we've talked about the different approaches to behavior change that are used by global health programs. So this was one that we covered. And a conditional cash transfer is basically when a government agency provides economic incentive for families, but it's tied to them doing a specific behavior. So the example we shared in class was Prospera, which the Mexican government started in the 1990s and has been heralded as quite a huge global health success, and has been a model for many other countries since. Basically, they provide certain groups, vulnerable populations, impoverished communities, with money in exchange for their children being enrolled in school, their maybe children being enrolled in like a nutritional program to improve child nutrition and reduce malnutrition, and even maternal services. So there could be money given for a mother who gives birth in a facility, which we know is tied to improved health outcomes, to have a skilled birth attendant. Or you could get an incentive, for example, if you come to all your antenatal or postnatal care appointments. So this is an example of a conditional cash transfer, because it is on the condition that the person receiving it does something that is meant to improve the social, economic, and health outcomes of the population. Then a non-conditional cash transfer is just the same thing, but there's no condition tied to it. It is just giving people relief, like a child allowance, income support, disability benefits, without them needing to do anything else. Lots of governments have this. We have examples of this, and both conditional and unconditional cash transfers have been shown to improve health outcomes for populations. So, there is a camp within global health that feels like it is that people, if you give them money, they tend to do the right thing with it. They tend to use it to help their families lift themselves out of poverty. So that conditional aspect is not necessarily needed. This is what this debate is, or the different philosophies behind these two approaches. So moving on to some content from our environment lecture. We talked a lot about sanitation, water, and hygiene. Sometimes that's actually water, sanitation, hygiene, which we call WASH. And some key points to know about WASH for the exam is how the burden really falls primarily on children, and that we see sort of the worst outcomes in countries that struggle with poverty, particularly those in South Asia and Sub-Saharan Africa. This burden falls on children in terms of health because of the conditions that tie to diarrheal disease that we know is a leading killer of children globally. One other thing to know for the exam, I note there that you should know why we call NTDs neglected tropical diseases. We've talked about this not just in the environmental lecture, but it came up in nutrition, it came up in child health, right? So these are examples of them are things like dengue fever or intestinal parasites, which is, the child pictured in this image is suffering from that. They're called neglected because they generally impact the poorest communities in the world. And because of that, they've historically not received a lot of attention, a lot of donor money, a lot of government attention in terms of global health programs. So, one thing we talked about was that it's not a moneymaker for pharmaceutical companies to work towards drugs that could alleviate or cure some of these problems, because if it does affect the poorest communities in the world, who's going to pay for it, right? So that's part of this problem. So it was sort of repackaged by global health organizations to kind of bring more focus on it as neglected tropical disease, as a way to get people's attention that actually this is a burden on a huge portion of the world, and really contributes to a lot of problems, a lot of deaths when you take them all together, as well as a lot of malnutrition and underlying conditions that affect children, but they have not historically received the attention or funding that they deserve. So when it comes to WASH, water, sanitation, and hygiene, you should know what is the most cost-effective approach to averting DALYs, or disability-adjusted life years. And if you look here, the column on the right shows us the dollar amount per daily averted. And so the most cost effective is hygiene promotion. It only costs, $3+ per daily averted. If we can get people to wash their hands and engage more in hygiene behaviors, this is going to have the biggest impact and the biggest bang for our buck compared to these other ones that we know are important and work, but are more expensive and have less of a health impact. So moving on to nutrition, there are a number of key terms that are used typically for us to gauge the health of a child and how we measure and identify children who are at risk for malnutrition. So those are listed here, the ones that I would focus on for the exam. Low birth weight is a child whose weight is below 2,500 grams. We know that low birth weight is an important measure because it's tied to other health outcomes for children, but also developmental outcomes over the lifespan of a child. So low birth weight is something that we measure quite a bit in global health and is an indicator of like good nutrition in pregnancy and a lot of, antenatal care and a lot of things that are actually tied to maternal health. A child who is stunted, this is measured by height or age. It is a child's height being 2 Z-scores below the international reference for height and age. If you've taken a statistics course, a Z-score is tied to like that normal distribution. But basically, I think what's important to know is that it's a condition that happens, being stunted, from being chronically undernourished. So children who over the long term are affected by malnutrition are going to be shorter than what is expected for their age because of that long-term effect. A child who is underweight is weight for age. So their weight is 2 Z-scores below the international reference for weight for that age group. And then wasting is weight for height. So this is kind of like a very skinny child. This would be kind of identified by someone who is, kind of skin and bones for their height. So this, different from stunting, is tied more to a more intensive short period of malnutrition. So when we see children who are like going through famine, maybe because of war or conflict, or because of maybe food shortages, you see that wasting happening where they have not been able to get nutrition and they have lost weight rapidly. That is what wasting is in reference to. So this is the graph that we looked at to understand some of the determinants of malnutrition for children. But I think the most important thing to take away for our exam is this link between disease or infectious disease and chronic malnutrition. So we talked about that cycle that exists between malnutrition and infection, where children who are experiencing kind of chronic infections because of poor wash, because of like high infectious disease where they live, high diarrheal disease, they are subject to becoming malnourished, right? Because of that illness. But then when we are malnourished, we're actually more likely to be susceptible to infectious disease. So because our immune systems are weaker and we're less likely to be able to fight that disease. So this is that chronic cycle that needs to be broken in order to reduce childhood deaths in low and middle income countries where, why do we see so much death from diarrhea? A lot of it has to do with not only the fact that these infectious diseases and waterborne illness and foodborne illness is prevalent, but that those children are also suffering from malnutrition, which makes them more likely to die or suffer serious outcomes when they do get infected. So moving on to communicable diseases, this is a slide showing the different transmission paths for communicable disease. I think what's important to know is sort of the range of different ways that infection can be transmitted, like through food, through water, through sex or blood, etc. And you should know examples of each of these things. So I would study this slide to be able to identify that cholera is waterborne, that tuberculosis is through inhalation, that HIV and hepatitis are sex or bloodborne. We also have the different control measures. This is, I believe, listed on your study guide, so I won't go into great detail here because I think you can study it directly, but it would be important to be able to identify, which of these, that basically the purpose of these is to control infectious diseases. So we also talked about this link between it's quite a bit going on here. Pandemics and the environment being the degradation of the environment, that we are chopping down forests, and as a result, there is much more contact between animals and humans than ever before. Part of that is that environmental degradation because of like rapid expansion and growth. It also is because of our food system, that we have these huge factory farms with animals and infection happening there. But basically all of that has come together to increase the rate of emerging and re-emerging infectious diseases, because 60% of all emerging and re-emerging infectious diseases are zoonotic, meaning the infections spread from animals to humans. Our understanding of SARS, our understanding of COVID-19, that they all have that zoonotic origins. So that is the takeaway here. Injuries, it's important to know, the largest causes of unintentional injuries globally are the ones listed here: road injury, poisonings, falls, fires, and drownings. And it's also important to know that 6% of total deaths due to injuries are in high-income countries compared to 9% in low and middle-income countries. So a takeaway there is that there's more deaths happening in low and middle-income countries due to injuries than high income, which is probably not surprising. Okay, so we are now moving on to maternal deaths, and then we'll go on to child deaths, or health, that is. But here it is focusing on deaths. We have basically the top causes of maternal deaths globally. So you should basically study this graph and have an understanding of what the top, causes of maternal deaths are. If you look, we have hemorrhage being 27%, and in terms of the big five, that is actually the leading cause of death for women. Even though those indirect causes are 28% on the graph, I would not focus on those so much, but focus on these other ones like that are listed in this big five. Hemorrhage is bleeding, if we remember that. The other thing I think is probably important, actually, before we move on about maternal deaths, is that when it comes to preventing or reducing the amount of maternal deaths that happen globally, the thing we need to invest in is obstetric emergency care. So if you recall in our lecture, we talked about how these things that cause women to die are hard to predict. They happen quickly and they require expert intervention and often surgical intervention. This is what we would call like emergency obstetric care, the ability to do an emergency C-section, right? And we know that there's not the capability to do that in many low and middle income countries, and women who are giving birth outside the facility definitely don't have access to that. So increasing the amount of access and quality of emergency obstetric care is what is going to actually be the thing to reduce the biggest way to reduce deaths that are maternal. The other thing I think you should know is how we can reduce deaths due to abortion. So we know that these deaths due to abortion are probably entirely due to unsafe, illegal abortion, right? So this means they're not happening in a facility, they're happening outside of a clinic, and they're happening, basically in an unsafe way. The biggest way to prevent that, although there are other ways to prevent it, the biggest way to prevent it would be actually making contraceptive use acceptable and accessible globally. So family planning, people have abortions and have unsafe abortions in particular because they're having an unintended pregnancy and they don't want to carry that baby to term. So the most cost-effective way to prevent deaths due to unsafe abortions is actually making family planning accessible and acceptable to people, because then they wouldn't be in that situation to begin with. Okay, you hopefully recall us having a breakout session and discussing these pathways between violence and HIV. So I would want you to study this graph and have a sense of the different pathways in which women are at risk. Women who are in an abusive relationship are at greater risk for HIV. So we have that direct transmission at the top of the graph. Basically, if you're in an abusive relationship, rape or sexual assaults, could be part of that abuse. And so you're at risk of a direct transmission through that sexual assault. These more indirect pathways are that women in abusive relationships could be going through psychological distress, which results in depression, substance abuse, that could lead to their riskier behavior, like having more partners or having sex while intoxicated. It also can increase, it also can reduce the power they have to, basically control the use of a condom. The abuse in itself also has that direct path of reduced protective powers for women. And then, as we talked about in class, there's also this pathway between men who are abusive are actually also more likely to be at higher risk for HIV themselves. So they might be more likely to have more relationships outside of relationships or sex with people outside of their main relationship, less likely to use condoms, more likely to have HIV and STIs overall. So that puts, the women in relationships with them also at further risk. Okay, so this graph then shows the top causes for children under 5 of death globally. And I have the notes here that I have in our study guide for what you should know out of this. The top causes of death for children 1 to 59 months, the top causes of death for neonates, and then the percent of deaths occurring in the first month of life. So this isn't the way, let me move that. So top causes of death for children 1 to 59 months. So this is saying 1 year old to like right under 5, right? And if you look, the graph is split in 2 ways. The yellow side is neonatal deaths, and the other side is everyone older than that, but under 5. So what are the top causes of death for children on this side of the graph? Well, we're just looking for the biggest chunk of the graph. We have 10.1% lower respiratory infection. This is pneumonia and other respiratory infections. We see a similar, but not as large section for diarrhea. Okay, so this is the takeaway. On this other side, neonates, if you recall, neonates are basically children in the first month of life. Top cause of death, we have 16%, almost 70% of deaths due to preterm birth complications, okay? So this is preterm birth is what we call premature birth. They were born early and there were complications due to that. Percent of deaths occurring in the first month of life, that's right here, 46%. Almost half of all deaths of children under 5 occur in the first month of life. Very important to know in terms of how can we reduce deaths among children. Well, half of them can be reduced with a focus on neonatal health interventions focused on maternal health because they're very, very related. So we had a little video where we talked about kangaroo mother care as a very cost-effective way to reduce actually what we just talked about, these preterm birth deaths due to preterm birth complications. So here we have a mother with a baby who was born premature. So this is a preterm birth. And instead of using an incubator, she is using her skin-to-skin contact. This intervention is known to have almost, just as good of an outcome as using an incubator if you keep that baby warm by keeping her on her mother's or father's or anyone's chest, any caregiver's chest. So you should know for the exam, basically, what is the purpose of this? It's to improve health outcomes for preterm babies and is very cost effective. Okay, this might be our last slide. This is the integrated approach to reducing pneumonia and diarrhea. And if you remember from our lecture, we talked about how global health programs have made an effort to package pneumonia and diarrhea, even though they're very different illnesses. They've made an effort to package them together and make programs that kind of try to address them both simultaneously. Why? This is because pneumonia and diarrhea are the top killers of children in that age group of, over 1 but under 5, right? So these are, if we want to reduce preventable deaths among children, these are 2 things to target to really make an impact. And they actually share many of the same determinants or risk factors. So, and because of that, that means much of the interventions that would actually work to reduce them are the same. If you see, we can prevent both through vaccines, through hand washing with soap, safe drinking water. These are a lot of those like wash interventions. Similarly, we can reduce the risk of both through breastfeeding, through proper nutrition, etc. And then they could be treated together. So we could train health workers and community health workers to be able to identify children experiencing these and then intervene. So the key takeaway here is that these 2 illnesses share similar risk factors and their interventions can be similar, so they're often packaged together. So that's everything. I hope that this is helpful. I am available. If you have questions, please, reach out. Like I said, I would study, this is just meant to be a review and help to supplement and give you some more information about what's in the study guide, but please do be thorough in reviewing the study guide yourself. And I think you'll be very successful on the exam. So thanks very much.